Hi, my name is Hillary Holbrook, and I work with your doctor. He prescribed you with the TENS unit today for after your surgery. This is the device. This is a TENS unit. TENS stands for Trans-cutaneous electrical nerve stimulation device. Basically what that means is if you've seen a chiropractor or a physical therapist before, they have put this on you and put little stickers on you, sticker electrodes, and it gives you a vibrating, massaging, tingling sensation. And that's basically to interrupt that pain signal and give you some relief after your surgery. Also, it will help you heal faster. And the way that it does that is when it stimulates the nerves in the area that the electrodes are on, it's going to increase that blood flow. It's going to draw in blood proteins and increase your endorphins, and it's going to help reduce swelling. And those are all really big components in healing. So people tend to focus on the pain management aspect of it, but it also helps you heal faster. Surgery is traumatic itself. So it's going to start that healing process and get things moving again, get the blood flowing, and those are the two reasons that you'll be using this. You will own this. It is yours to keep. You don't return it to me or the doctor. It belongs to you, okay? So I'm going to go over how you use it and everything you need to know about it, and that's about it. All right, this is the TENS unit. Okay, the way that you open this is you push into it like the back of a remote control. So I want you to watch me just kind of push in, slide it off, and then you wiggle it back and forth to get it off, okay? Inside here is the hole for the 9-volt battery, all right? The company sends 2 batteries. These die pretty quickly, so don't be surprised when they do. I put an extra battery in here to help you get through a little bit longer. If you saw me face-to-face and in person, then you got this extra battery. If you had to be mailed this unit because you were prescribed this in office with your doctor, then you won't have this extra battery, unfortunately. But you have 3 batteries in there, 2 from the company, and then this Energizer battery, all right? Now, the settings in here are preset. You will not need to change or adjust these settings. The only reason that you're gonna open it is simply to change the battery, okay? If you did receive this in the mail though, just so you know, I would like you to set the device to the settings that I have it set at, okay? So on the top part here, if you see there, it says mode. I want you to have mode set to the letter M, okay? Below that, you will see the timer, and I want you to have it set to the letter C. It is either set at C, 30, or 60, and I want you to set the bottom one to the letter C. Then you have here on the right, those dials. That is the pulse width. I want you to set that to 150. And then over here on this side, it's the pulse rate. And I want you to set that to 70. So that's between the 60 and the 80. Those are the settings that it needs to be set at, okay? But again, you won't need to touch or adjust these, especially if you saw me in person. I already have the device set. That is only for patients who are receiving this device in the mail straight from the company when nothing is set on it, okay? So like I said, the only reason you'll need to open it is just to change the battery. And then you're gonna go ahead and slide it back on in there, all right? Now, it makes it fairly simple to use. These 2 dials here are how you turn it on and how you increase the intensity, okay? So it's got this cover to protect it. And right now, I'm gonna use a clock analogy. So if you look at these 2 dials like it's a clock, off falls in the 6 o'clock position. There are tick marks here. You can hear them, but they're difficult to see. So right now it's set to off. Now just for an example, I'm going to set the device to 2 on both sides. So now you'll see that the number 2 is falling in the 6 o'clock position if these dials were a clock, okay? So you hear it click when you turn it off and on, okay? So right now I have it off. There's no battery in here. But when there is a battery in here, these 2 little dots right here light up and they're orange, all right? Now when these orange lights flash at you and they blink at you like that, that just means the battery is dying. You may not necessarily even notice the lights flashing until you realize that you keep having to turn it up to feel the same level of intensity that you felt. And then you'll glance at it and notice that they're blinking. It won't cut off. It will just get duller and duller, okay? So the way that you use this is you simply turn it up as high as you can take it. Everybody's different. I might be able to tolerate up to the level 4. Someone else might not get past a 2 or a 1. It really depends on the person. So you need to be in charge of it yourself. It's not a device for people to mess around with you with. It's not a family torture device. I want you to be in charge of how high it gets turned up, okay? So I want you to go really slow. The dials are really sensitive. So I would go from a 1 to even between a 1 and a 2, and then to a 2. Between a 2 and a 3, and then to a 3. So just go real slow. And the way that it's set is you'll feel it come in waves. So you'll feel that sensation, and then it'll go away. You'll feel it, and then it'll go away. So that's why I want you to just go slow and wait and see how it feels before you turn it up. At the point at which it becomes uncomfortable or unbearable, back it down a little bit. It's not going to hurt unless you turn the dials too quickly. It may be a little more uncomfortable than normal, but the point at which it becomes uncomfortable, back it down right before that happened. I want it right at that threshold. I don't want it so high that it's uncomfortable or unbearable, but I don't want it so low that you can't feel it or it's not going to do its job. Okay? So I want you to have this device on and running for post-op patients, post-surgery, 24 hours a day for the first 3 days. 24 hours a day for the first 3 days. After that, you can use it as needed. For shoulder patients, if you had a shoulder arthroscopy for any kind of repairs that he did, it's fairly achy, so a lot of shoulder patients use it for about a week. If you're an ACL patient, anything else, a week is a good amount of time as well, but you certainly can use it longer. Okay, so after the first 3 days of 24 hours a day, you can continue to use it for 24 hours a day, or you can switch to intermittently throughout the day. If you do that, just make sure you have it on for a minimum of an hour. 10, 15, 20 minutes isn't really going to help. You need more longevity with the amount of time that you have it turned on. Okay, so inside of this box, I'm going to show you where they're going to put the electrodes on you, and then the supplies that you have in here real quickly, and then we're all done. All right, so in the operating room, they're going to put 4 sterile electrodes on you. If you're a shoulder patient, I'm going to show you on my left shoulder because I'm right-handed. They're going to put one on you right here. It's a little sticker electrode. It'll go on top of your skin, but underneath the white gauze and tape. So they're going to put one on you right here, one here, and one posterior. They're basically making a box around your surgical site. If you're a knee patient, they're going to make a box around your knee. So they'll put 2 below your knee and then 2 above your knee. And they're little square sticker electrodes. They will receive sterile electrodes for the operating room. That may be a different color and a different shape than these ones that you have for your at-home use, but they're exactly the same, other than the fact that they're sterile for the OR. Okay? Now, I have a pamphlet in here for you, and this shows you where the electrodes are placed. The little squares are the electrodes, okay? Those lines are the cords, and I'm going to show you those real quick. But this shows you where these electrodes are placed on your body for post-op, or where the other places that you can use this device if you want to use it for other things, which is why it's fantastic to have. You can use this for all kinds of pains: neck pain, knee pain, ankle pain, shoulder pain, back pain, and sciatica, all kinds of conditions. Okay, so let's focus on your surgery today and the next few days, but you now have this device for other things if you desire. All right. So you'll have this pamphlet that will show you where the electrodes go. Now, when you get home, the only thing you're going to need to do is take these 2 cords out of your box, okay? I want you to plug both cords into the top. Each cord splits into 2, all right? This is where your family member will come in and will need to help you. I want you to take one end of the cord, if you're a shoulder patient. I want you to plug it into that electrode that's on the front of you. Take the other end of this same exact cord and plug it into the electrode on the back of you. So you'll have one cord going front and back. Then I want you to take that whole other cord and plug it into the top and then on the bottom, top and bottom. So you'll have one cord going front and back, top and bottom, making an X just like this. And it shows you in that picture, but showing on myself seems to make more sense. Okay, if you're a knee patient, you will simply plug it into the top of your knee. If this is my kneecap, you'll plug it into the electrode here and here, and then you'll plug it into the electrode here and here. So I want you to take one end of the cord and plug it on the outside of your knee. Take the other end of the same cord and plug it in on the inside and the bottom. So you're making an X and you're crossing over. One whole cord will go outside to inside, and then the other cord will go outside to inside. If you put red on the top, put red on the top from the other cord. If you put red on the bottom, that's fine. Just make sure you put red on the bottom from the other cord. You're making an X, and I want red both on the bottom or red both on the top. Doesn't matter as long as they're the same. next to each other, okay? That's for your knee if you're an ACL patient. So that's what these 2 cords are for. You have the 4 square sterile electrodes, or rectangular, and you have 2 cords, and each cord splits into 2. You plug into those electrodes, then you turn on the device, all right? You're gonna have a block today after your surgery. That block is gonna give you a period of numbness for however long the anesthesiologist told you. I want you to turn it on and set it to a 1 since you don't know your tolerance level, so it can help start the blood flow even though you can't feel it for pain management. So set this device to a 1 on both sides, wait till that block wears off, and when you start to feel that surgical area again, then you can start turning it up and start using it for that 24 hours a day for the next 3 days. And the only other things that you have in here is this little booklet sent by the company. If you want to take a nap, feel free to read that. Here's your pamphlet. And this shows you where the electrodes go. And then you have these home use electrodes. So whenever you're dressing your gauze, your tape, or your brace, or everything that's on your body is able to come off and you can finally shower, you can switch over to these. These are for your at-home use. You don't need to change electrodes if they're trapped underneath all of that. Do not remove your gauze or tape. That is not recommended. It is up to your surgeon when you're able to remove that, all right? These are the electrodes for your at-home use. These are reusable. So once you get out of the shower, you can go ahead and put these new ones on you, or if you're a knee patient, around your knee, and then use these if you're still using it for a knee patient, because I know your electrodes will be trapped under there for quite a while. So these are reusable. What I mean by that is when they lose their stickiness and they no longer adhere to your skin, you can hold these under cold water, no soap, take your finger, clean them off, get the excess water off. They're a little bit gelatinous. You can put it back on here, put it back in this bag, leave it in the fridge for about 12 hours. They should be sticky again. You can't do that over and over and over and over, but you should be able to get 4 or 5 more uses out of it, all right? Now, the company sends 2 packs, so theoretically, while one's drying, you would have this whole other pack to keep going for 24 hours a day for as long as you need. I put 2 extra packs in your box, so you now have 4 packs of electrodes, so you should be perfectly fine. And then the last 2 things that are inside your box, you've got these batteries here, the 3 batteries. You've got 2 business cards, 4 packs of electrodes, this pamphlet, and this pamphlet, and these 2 cards. This card right here is an 800 number to request more electrodes. You should get more electrodes in the mail in about 4 to 6 weeks. Obviously, you shouldn't be needing to use this in 4 to 6 weeks, but it would be nice to have the extra electrodes to kind of have them stockpiled. So if you don't get some in 4 to 6 weeks, or you need some sooner, which hopefully me giving you these 4 packets helps alleviate that, but if you need some sooner, you can call and request more. That is what this card is for. You can't request anything else other than electrodes. And this is only covered for about 2 or 3 months after your surgery because the prescription expires then. So you can't call a year from now and request more. Then this other card is the only other card in the box. This card has my name on it. I'm Hillary Holbrook, and I work with your doctor, okay? Down here on the bottom, you have a fax number and my personal cell phone number. I give my phone number to patients so that way if you get home and you forget something I said and you have a question, you can call me directly. I have given an extra sheet inside the TENS unit box with my instructions in my words so that you can read over that if you have questions. Hopefully that will help you and you won't need it. On that sheet, it also has the link to this YouTube video. So after watching this, that should cover all your questions as well. I'm a lot more long-winded in this video than I am in person because I'm usually under pressure to hurry. So hopefully you wouldn't need this, but if you do, that's what I'm there for. If I don't answer, make sure you leave a message because I don't call back numbers that I don't recognize just because it's my personal cell phone. So when I hear your message, I will call you back. I won't make you wait. And that's pretty much it. Hopefully this helps you, and I hope you enjoy your TENS unit. It's very helpful, and that's it. Thanks.